Hello and good evening, everybody, and welcome to today's guest, Dr. Jonathan Stea. Is that pronounced right, Stea?
Yeah, you nailed
Yeah,
it.
I'm going to read your bio here from your website. So Jonathan N. Stea, Ph.D, Psych, is a full-time practicing clinical psychologist and adjunct assistant professor in the Department of Psychology at the University of Calgary. Clinically, he specializes in the assessment and treatment of concurrent addiction and mental disorders. So I thought, what a great person to bring on and talk about mental health and the importance of mental health. I saw a video that you did with Melanie Tressett King with her channel Thinking is Power the other day, and you mentioned Scientology, and I thought, let's message Dr. Jonathan Stea and say, hey, is there any chance you want to come on the channel? And to my surprise, you said yes. So welcome.
Thank you so much. I don't know why you're surprised. As we were mentioning earlier, like I admire and respect anyone who's kind of left Scientology. I admire your work and the advocacy that you're doing. It takes so much courage and bravery, and it's quite a feat to kind of endure that emotional turmoil, so to speak, to leave any kind of rigid kind of ideology. So yeah, it's my pleasure. I'm excited to be here. So thank you for inviting me.
Thank you. And please excuse me if I ask some really dumb questions. I'm not a mental health specialist or expert in any way, shape, or form. I just thought it'd be interesting to talk to a trained professional a bit about Scientology and the pseudoscience of Dianetics. You've got a book coming out that we can talk about, and their role in the anti-psychiatry movement. I think that might be a good place to start, actually, is Scientology like to think of themselves as pioneers in the combating psychiatric abuse field. And when you're a Scientologist, you are taught that all psychiatrists are bad. They are paid by big pharma. All they want to do is prescribe people drugs, and they earn money for that. And no psychology or psychiatry is going to be helpful to anybody. The only solution is Scientology. And there's a part of that they go and protest, and there's CCHR, the Citizens Commission on Human Rights. From your position as an expert in the mental health field, are Scientology known as fairly anti-psychiatry? Are they considered quite big players, or are they just more a little bug on the windshield you can kind of ignore?
Well, first of all, good God, that narrative that you depicted, like it's scary, and it's meant to be scary, right? It's meant to fear monger and scare people away and deter treatment seeking. I don't know how well. I mean, I suppose it would be. It's sort of imbued in popular culture. That's the extent to which it's well known, right? Like Tom Cruise chastising Brooke Shields for for using antidepressants to treat postpartum depression, things like that, or all the Danny Masterson stuff that's been kind of in the news. So, but within the confines of the mental health world, so to speak, I think the bug on the windshield kind of metaphor is more apt. At the same time, the tropes that Scientology will parrot, and by tropes I mean kind of recurring themes or recurring ideas about psychiatry, like you said, that it's all harmful and dangerous. Those tropes are permeated in popular culture, and they come from different sources, not just Scientology, but Scientology is certainly one spoke on the wheel of this anti-psychiatry movement that I'm really trying to help people become more aware of because of this dangerous narrative to people's mental health. So,
Absolutely.
yeah.
What makes it dangerous? Because from my perspective, I agree, it's dangerous to have this false narrative. I think psychiatry does and can help people. There are, of course, as with any sector or whatever you want to call it, there are always going to be abuses, people that don't get it right, and there's going to be question marks. So I'm not saying that all psychiatry is good. There are going to be some misapplied or some wonky psychiatrists are doing the wrong thing, but as a whole the industry is there to help people who are in need and support them, sometimes with medication, right?
Totally. Yeah. And all of medicine, including psychiatry, is a scientific endeavor. So it's basically self-correcting, and it tries to help people. That's what, that's baked into the codes of ethics and legal standards of practice of these professions. But maybe I'll step back just maybe for your listeners and just kind of describe the anti-psychiatry movement so that people can kind of get a handle on what I mean by it or what we mean by it. So it sort of dates back to at least the 1960s. And that time it was good, as you're saying, because psychiatry, it was a reaction to psychiatry's dark past and psychiatry's missteps, right? There was inhumane treatment of patients in asylum care. There was inappropriate pathologizing of minority groups. There was this perceived arbitrariness of diagnoses, meaning, there was a reaction to people not knowing what mental illness is. And so sort of in the 1960s, it was really, this movement was sparked by a few different areas. One was this psychiatrist named Thomas Sass, who wrote a book and an essay called The Myth of Mental Illness. And he was joined in his efforts by other kinds of disgruntled psychologists or psychiatrists and kind of scholars in the area. So David Cooper coined the term anti-psychiatry in 1967, and he was joined in his efforts by other philosophers like Michel Foucault. And so basically all of this movement in part had a reason. It was trying to push psychiatry into a place where it could be more humane and more scientific. The good news is that psychiatry listened. It got its act together, so to speak. It shut down a lot of those asylums. It moved patient care into the community and kind of normal hospitals. And the science, so to speak, got a lot better because there was a much more lively focus on not just biology, but the biological, psychological, and social factors that contribute to mental illness. And so by about the 1980s or so, the psychiatry again kind of listened, and the movement greatly diminished, the anti-psychiatry movement. But it didn't die. It just sort of transformed and lost its way. And so now you see psychiatry, the modern incarnation of anti-psychiatry, shows up in things like Scientology, which is one spoke on the wheel. Then there's other kinds of fringe scholars or fringe experts, so to speak, again, self-identified disgruntled scholars or psychiatrists who will publish their opinions and propaganda in various sources like books and blogs and opinion articles, basically outside of mainstream medicine on websites like Mad in America, which are really designed to blame psychiatry in a way that dodges scientific critique. And then then another spoke that we have on that wheel of the anti-psychiatry movement comes from people who identify as being harmed by psychiatry, so some harmed patients. And that's a real thing too, just like we would see in the anti-vaccine movement where people identify as being harmed by vaccines. And so those people deserve a lot of compassion, and they deserve to be listened to. At the same time, multiple truths exist. What we see especially on social media and on forums, is that some folks in the online community will share a lot of propaganda and a lot of those anti-psychiatry tropes that I mentioned, which do a great disservice to patients, because ultimately the harm, you asked what's the harm of these things, and the harm is that with misinformation and anti-psychiatry propaganda, the aim of the modern anti-psychiatry movement is to deter treatment seeking, and that can compromise patient care, and it can affect their health decisions. And the patients that I see will see some of those tropes that will present to clinic, because they're so pervasive and baked into our culture that there's a lot of, say, influencers out there who will parrot a lot of these tropes, whether it's from Scientology or other sources of the anti-psychiatry movement. They'll parrot these tropes without even know where they're coming from. So, for example, Andrew Tate, a notorious guy who is, tweeting to hundreds of millions of followers that depression doesn't exist, or Elon Musk saying that SSRIs, which are antidepressants, are more harmful than helpful. Those are tropes. I wouldn't consider Andrew Tate or Elon Musk anti-psychiatry per se, but they're repeating these ideas, and I don't even think they know where they come from. They derive from places like Scientology and these kind of fringe scholars. And so you mentioned the CCHR, and that was started by Thomas Sass, who I mentioned, who sparked the anti-psychiatry movement, and he founded it along with L. Ron Hubbard. So that's a long-winded way of just trying to give a kind of a backdrop of the anti-psychiatry movement.
No, you're absolutely right. And I think one thing to remember as well, and I don't know if you're aware of this, but in Scientology, everything came from L. Ron Hubbard, who died in 1986. But it's actually against policy to change what L. Ron Hubbard wrote. You can't change policy. What he wrote is gospel, right? And you have to apply it exactly as it's written. So a lot of Scientology's beliefs and thoughts on psychiatry, among many other things, are very dated because they're based on L. Ron Hubbard's understanding of psychiatry back in the 50s, the 60s, and the 70s. Not they don't take into account kind of the development of psychiatry over time, because they can't change the policy. If it says psychiatry is bad, Scientology will always consider psychiatry to be bad, no matter how it changes. Have you seen a change at all in the anti-psychiatry movement as a whole over the time that you've been working in the field, or from your study of the history of it? Or is it all kind of always been the same kind of attacks?
Well, first, I like to say I didn't know that, in terms of like that, it's sort of gospel and that it can't change. And to me, that's just, that's amazing insofar as it screams this, well, it's a pseudoscientific warning sign. I write about this in my book, where there's a lot of, when we try to define what a pseudoscience is, there's a lot of different warning signs. And one of those warning signs is when a claim or a theory or a set of ideas doesn't change, just as you're describing these sort of anti-psychiatry ideas. It's the same with astrology. It's what makes astrology in part a pseudoscience. Astrology hasn't changed for thousands of years, and that's why the horoscope from long from our ancestors is the same that you'll read in your Sunday newspaper. So it's the same. That's a fascinating idea. Then with it's kind of what makes something a pseudoscience, or even borders onto religion, or cults. And so that's fascinating. In terms of sort of what's changed about modern anti-psychiatry, much hasn't, actually. I mean, you kind of nailed it, because a lot of the critiques which helped psychiatry get its act together was trying to force psychiatry to be more humane, to be more what they considered holistic, or a focus on those biopsychosocial ideas. And psychiatry did listen. And so much of the modern claims against psychiatry is it's not new. It's not something that psychiatry already incorporates within its own biopsychosocial lens.
Yeah, I think that's one of the things that makes it dangerous from a Scientology perspective as well. I mean, there's lots of things, but one of them is, when I left Scientology, it took me several years, almost a decade, to come to terms with the trauma and everything that I went through, but then to get to the point where I was comfortable admitting that I might benefit from speaking to a counselor or a psychologist or a psychiatrist. That was a huge hurdle in my head, because even though I have thrown out the belief system of Scientology, these things are still implanted in your mind. And you kind of think, well, all of this stuff, the abuse in psychiatry, they've told me all these things, and, maybe they might not be out to get me. Maybe it's worth a shot. And then when I was first prescribed antidepressants, that was a thing. It took me weeks just sitting there looking at them before I was prepared and okay to take them. And then it took several weeks before I realized, oh, actually, no, these were helpful, and they got me through a really rough time in my life. But the point at which I sought help was so much later than it should have been, simply because of the long-lasting impact of what Scientology had taught me about psychiatry.
Wow. Well, first, congratulations on sort of breaking free from those shackles, because that's a huge deal, and that's so very important. And it sort of speaks to just the, even more broadly outside of Scientology, like that's the harm of misinformation. When we hear it repeatedly over and over and over, it sort of capitalizes on our psychological biases. There's something called the illusory truth effect, which just means the more that we hear something, the more likely we are to believe it, because our brains aren't good at differentiating familiarity with the truth. And so that's a dangerous thing. And so in something like a cult, or a really tight-knit, dogmatic kind of community, you hear things over and over and over. Of course we're going to believe them. Our brains are wired to believe our peers. And so it's not about blaming or shaming people. It's really about, well, how the hell do you break free from that, as you did? And that's a really tough thing, and I admire that.
Thank you. And, every Scientologist that leaves goes through a similar journey. Everyone's recovery and healing process is different, of course, but every Scientologist has spent hours, if not hundreds of hours, being told that psychiatry is bad and to seek help is not okay. And when you do seek help, that isn't actually going to be helpful and it's just going to harm you. I was wondering if you could dispel a couple of these rumors that we were told in Scientology. So, for example, the first one is that psychiatrists and psychologists are all paid by big pharma, and there's a financial incentive to hook people on drugs as a method of controlling people. Is that true?
Well, it's sort of, you can see it, like we're laughing at the absurdity of it because it sort of borders into conspiracy territory, right? Like that it's meant for a method of control, and that's sort of what we're trying to do. It really takes the position that that healthcare professionals, mental health care professionals, are very nefarious and malicious in their intentions, which is not true at all. From a physician standpoint, which is a psychiatrist, people, I mean, big pharma has played a role in health more generally. And so one thing about earning trust from the public is to disclose conflicts of interest with respect to studies, and with respect to studies, so that we can have really transparent science. So no, not all psychiatrists are paid by big pharma. I get this, it's called the shill gambit, right? People accuse you of being a shill. I've probably been called a shill every day on social media for a couple of years. And the irony of that is that big pharma doesn't give a crap about me, so to speak, because I'm a clinical psychologist, and the vast majority of clinical psychologists don't prescribe medications. So big pharma doesn't care about me. I don't prescribe. Why would they take an interest in me? My day job involves individual therapy and group therapy work. And, I work on a great interdisciplinary team with other psychiatrists and, say addiction medicine physicians, where we will involve medication in a treatment plan if we think it's warranted. But I wish I was paid by big pharma insofar as, the amount of accusations that are launched against me. I find it deeply ironic.
Yeah, and I get the same thing. Another lie that Scientology tell its members is that ex-Scientologists, activists, people who speak out against Scientology are only doing so because they are paid by big pharma for spewing content online that's negative about Scientology, and they're making up everything about their experience. I've been speaking out for 18 months. I'm still waiting for my big pharma check. I'm disappointed it hasn't arrived yet.
They don't know we exist is the reality.
Exactly. Yeah. Another one that they talk about, and I think this might be a little bit more nuanced, and so we can pick it up another time if it's a bit too in depth. But one of the things we're told in Scientology is that nobody actually knows how antidepressants really work. We just know that they do help. And they're just prescribing them because they do help some people, but mostly they have negative impacts, and these scientists haven't done these trials to figure out how they actually work. Is there any science or truth behind that? I know there's a bit of uncertainty around the complexities of the brain, but that's a myth, right? Like most medical professionals understand the basis of how they actually work in the brain, right? Or no?
Well, it's no. Like it's what makes it a myth. It's not so much a myth as it is a propaganda tactic, right? Like that talking point will be taken out of context and be used to sow distrust in mainstream medicine, to say, you know what, mainstream medicine doesn't know what we're doing, but we do with our Narconon programs or whatever kind of stuff that they're doing. And so the reality across all medicine, not just psychiatry, is that there's a lot of treatments where we don't necessarily know the mechanisms of change. And so that is true of antidepressants. So what you do with mainstream treatments that work is you conduct randomized controlled trials, because what you're looking for first is safety and effectiveness. You want to make sure your treatments are safe and effective. And then once you do, you can elucidate the mechanisms of change. And so we do know that that serotonin, in the case of antidepressants, is involved in the brain, or it's involved in the brain and in the mechanism of change of antidepressants. But research is still ongoing to try to figure out exactly what that looks like, because at the end of the day, the reality is that the science of psychopathology or mental illness is incredibly complex. We have gaps in our knowledge. No one understands that, certainly not Scientology. So if anyone's getting closer to it, it's psychiatry, and we just don't. And that's the difference between evidence-based medicine and a pseudoscience or psychiatry, right? So psychiatry and evidence-based medicine is honest and it's forthright about what we know and what we don't. And we discuss those at the informed consent process. When you see things like pseudoscientific movements or pseudoscientific grifters or treatments, they will purport or pretend to have the answer and oversimplify ideas when in fact they don't. So
I think the humility there in you explaining the science is such a contrast to Scientology, where you're taught Dianetics is the modern science of mental health, and it is the entire way the brain works. There's a reactive mind and an analytical mind, and auditing is the only thing that will solve all of your problems. And this is a fine-tuned science. It is perfect, and when it's applied exactly as it's written, it will work 100% of the time, and there's no changing it whatsoever. That's completely opposite to everything you just described about what science really is, which is testing and, you know, evidence-based research, and just admitting, you know, psychiatry has been around for, you know, what, 100, 200 years, something like that. And people still don't know exactly what's going on. And it's all about learning and developing the science and the understanding, right?
Absolutely. And what you just said, the way you described Dianetics, I mean, those are the hallmarks of pseudoscience, is to claim that they do know everything and they do know how it works. And the evidence is that that's just not true. So it's very deceptive and it's dishonest. It doesn't respect patient autonomy or patient independence. And so that's very dangerous. And that's not what mainstream medicine does, including psychiatry. Again, it needs to be very forthright about what we know and what we don't. And the reality with not just mental health or mental illness, but all of health in general, is that we know less than we know. But just because there's a lot of gaps in our knowledge doesn't mean that we know nothing. And it doesn't mean that those gaps can be filled in and exploited by pseudoscientific movements or treatments like Dianetics, Scientology, or the wellness industry at large, which is another kind of area that I write about in my book.
Yeah.
Which I think is bedfellows with the anti-psychiatry movement.
Well, let's talk a little bit about your book. I've got your homepage up here, jonathanstea.com. I've put a link in the description. So this is your book that's about to come out, right? It's not released just yet. And it's called Mind the Science, Saving Your Mental Health from the Wellness Industry. Do you want to talk us through about the sort of things that you cover in the book, what it's about, why it's important?
Perfect. That's super cool that you can pull that up there. So thank you for that. This book is going to be coming out in a few weeks, actually. It'll be released on September 3rd in Canada and the US. It's a bit delayed in the UK, but it can still be pre-ordered. And I think the audio book will be, and the ebook is available in the UK. But anyways, my motivation for writing this is because I've been, it's been a mission of mine to get on social media and engage in science communication for the past, I'd say, 5 years or so, because I noticed that I joined a really great science communication community where I noticed that we all know there's a ton of misinformation out there in the world. There's a ton of mental health misinformation and pseudoscience. And so I really wanted to help people as best as I can. That's one of the ethical imperatives that I have as a psychologist. That's baked into our codes of ethics, where we have a responsibility to society to promote and practice evidence-based care. And the opposite of that means trying to help debunk mental health misinformation and pseudoscience. So after doing that for about 5 years or so, people would email me all the time or inbox me saying, Jonathan, is this website legitimate? Is this treatment a scam? Is this guy a quack? Is this article legit? And so, I've been trying to help people as best as I could. But then after a while, I learned a whole bunch along the way. And I decided that I really just wanted to localize all of that knowledge and just kind of help people protect themselves, learn how to do it themselves against mental health misinformation and pseudoscience. So that's what the book's about. It's aimed at a large general audience, so anyone can read it, anyone that's been touched by mental illness in some way, which is pretty much everyone, and just people that are curious about the intersection between mental health and science. So I'm hoping that it can be helpful in that respect. And the subtitle is Saving Your Mental Health in the Wellness Industry. The reason for that is, mental health misinformation and pseudoscience are everywhere. They're in our culture, they're in popular media, social media, but they're particularly prevalent in the wellness industry, which is the alternative medicine community. And so I do talk a lot about that, as well as the anti-psychiatry movement, and because they are bedfellows, so to speak. So what I mean by that is both the anti-psychiatry movement and the wellness industry serve as foils, or the opposite to mainstream medicine at large. They try to sow distrust in mainstream medicine. They try to create that polarizing, divisive narrative to basically say mainstream medicine doesn't know what the hell it's talking about. We do. Buy our supplements, buy our energy healing treatments, buy our Dianetics, whatever it is, any kind of pseudoscientific grift that's out there. It needs that narrative, though, to sow distrust, to fearmonger, to say they don't know what they're doing. We do. And so in the book, I'm trying to help people know when they're being scammed, know how to spot and identify misinformation and pseudoscience, because that's how people can better protect themselves from it. I want to basically teach the language of pseudoscience and alternative medicine grift and anti-psychiatry.
I think that's really, really important to give people the tools to watch out for this stuff. I did a live stream yesterday talking about the protected titles in the UK, about how you can call yourself a therapist or a counselor in the UK. Anybody can. That's no problem. It's not regulated, but you can't call yourself a clinical psychologist or a psychiatrist. Those are protected terms, and you have to be regulated by a body in order to call yourself that. But people don't generally know that. So if you're looking for help online and you see an Eventbrite page that says, come for a free life coaching session and we'll help you, we'll give you a one-to-one counseling session with trained experts, someone who's seeking support or assistance might look at that and it might be appealing. They might go, oh, this person might be able to help me, because they may not be aware that there's no regulation there. There's no requirement to know what you're talking about in order to call yourself these terms. I don't know what it's like in Canada, but it's important to know, how to navigate this industry.
Absolutely. It's like that across the world, like you said. So depending on particular countries and jurisdictions, there will be different legally protected titles. So like you said, nowhere is, a wellness coach or a wellness consultant or a life coach, so to speak. That's not a legally protected title, which means people don't need a license to practice. There's no training, there's no background, there's no regulatory body or college to sanction or to discipline people that kind of fall under, that commit malpractice. Unlike things like psychologists or physicians or nurses and social workers, all of those disciplines are regulated and they're real, and they have regulatory bodies and training programs and licensing. But like you said, anyone, your buddy can just set up an Instagram page and hang a shingle on their lawn and say that they treat post-traumatic stress disorder or addiction or depression or anxiety, and that's incredibly dangerous.
Yeah, absolutely. And I think that's how Scientology operate around the world, is they find the nuances of the law and try and get away with as much as they possibly can where they can. I want to ask you something in a second, but firstly, anyone watching this who's got questions or comments that you want to ask or say to Dr. Jonathan, please put them in the chat. I'm starring them as we go along. Jonathan has a hard cut in half an hour, so we're going to start wrapping things up fairly soon, but get your questions in and we'll ask them at the end. In the meantime, Jonathan, you said in this video with Melanie Tressitt King that you went to the Industry of Death Museum in Los Angeles, Scientology's big anti-psychiatry museum. Tell me about that experience. How, why, what was it like? Tell me everything.
I'm still making it up to my wife for dragging her to this museum. I'm still in trouble for it because it was so, I had to go because we were on vacation. We had a great time in LA, but I wanted to take like an hour or so to go visit this thing. Plus I wanted to get a photo for it because I included a photo in my book. That's kind of what led me to want to go there. Plus obviously I knew about it and wanted to read about it. A few years ago, that museum actually set up shop and went mobile in Canada. They were protesting not protesting, but just advertising, I guess, at the University of Ottawa, and the students protested against them. So that was quite a spectacle in the news, and I remember reading about that. But yeah, I went, that was several months ago. We went to LA. We honestly didn't last more than 10 minutes in there. It was in and out. I swear to God, it was 10 minutes because it was just really bad. So I guess the first thing to notice, which kind of caught me off guard, is you go in there and you have to sign up or sign in. I found that odd because
give us all your information.
Yeah, like what kind of, exactly, you had to fill out your name, first and last name, and I believe an email or a phone number. So we wrote some fake name on there because I didn't want to give them my real details. And they took us in, and just like you might see online, it was what you would expect. It was trying to make that fearful, dangerous, murderous narrative come alive and kind of stimulate our senses. So you go in there and you're just accosted with Holocaust imagery, terrified faces, injured bodies, pill bottles everywhere, as you kind of go through this guided tour. But yeah, we didn't last 10 minutes. A weird kind of side detail was that my wife, I noticed it, but my wife really noticed it, that it kind of smelled in there really badly. And I don't, that's why we couldn't laugh. I mean, she said it smelled moldy or just a really weird smell. And, that, who knows what that's about. But it was just, for me, it was more of like an ideological cesspool that I didn't want to be in. What also really struck me is that we weren't the only ones there. They actually had other tourists visiting. And so in my mind, I'm like, well, how many people are actually, deceived by this kind of stuff and believe it? I was kind of aghast at that. And so, yeah, we ended up just kind of running away, and, they wanted us to fill out a survey as we were leaving. We were kind and tried to say no, and they kept pressuring us. And so we went out the exit door in some back kind of room. that was it. But I got my photo. I got a photo in front of it with a thumbs down image, which I get harassed about actually on social media by some of these anti-psychiatry folks, which I don't mind. I think it's hilarious.
That was going to be my next question. That was going to be my next question, is like, what's your experience been like as a clinical psychologist, as an assistant professor in psychology at a well-respected university? You are like a prime target for Scientology and other people in the anti-psychiatry movement to try and harass online. I mean, I've seen some of the comments that you get on Twitter, and I love that your engagement with some of them. It does make me chuckle. But what sort of backlash or resistance have you had online just from being in the profession that you're in?
I appreciate that, and appreciate your kind of kindness and comments about that. But yeah, I'm certainly not alone in receiving backlash. Again, there's a lot of people who speak out against misinformation generally, that receive this kind of harassment or trolling, and just even it's worse than trolling. It's sort of it can be cyber stalking. It's abuse. I literally get about 100 abusive messages a day on social media. I'm not even exaggerating that number. It's about 100. It's been about that. It's been that way for 5 years or so. Not 100, but ever since Elon Musk took over Twitter, it's been about 100. So like a year or two now. Hundreds. It's usually coming from the anti-vaccine movement folks who are coming after me. I don't know if they're bots or if they're real. It's the alternative medicine folks, because I'm obviously speaking out against alternative medicine ideology, and it's anti-psychiatry stuff. And so, yeah, there's a handful of people who have been after me for at least 5 years, because I started speaking out against anti-psychiatry for 5 years. Yeah, and so obviously I feel really blessed that I have the coping skills to adapt to some of the stuff that I teach. And so I know how to cope with this stuff in lighthearted ways. I don't take it personally. I recognize that a lot of the attacks on me, obviously the people don't know who I am. So they're attacking an idea or a vision of who they think I am, and they're attacking ideas of what I represent. And so I try to tell people who are being harassed on social media to look at it through that lens or that perspective, because I think that can help people depersonalize the experience, because it can be really discombobulating for a lot of people, and it actually chases a lot of people away from science communication, and it gets them offline, and it can negatively affect people's mental health. So again, I found a way to cope, and so I'm able to do my lighthearted comments on it. But that took work. That takes emotion regulation skills, which I've been cultivating for a long time, but it doesn't happen for everyone. So yeah, thanks for bringing that up.
Yeah, and you're not alone in that. Anyone that speaks out about Scientology publicly is going to be harassed by, the Office of Special Affairs, which is the department that's called the Dirty Tricks Department of Scientology, that go after critics and former members. And then, regardless of your stance on Scientology, just being a psychiatrist, you're going to be subject to that from Scientology and from the anti-psychiatry movement, and the same for psychologists and so on. So it's really discouraging for people who want to try and help people, whether you're an ex-Scientologist or whether you're, a mental health professional. It doesn't encourage people to pursue that profession and be like, hey, I'm going to help people with this evidence-based science, this, real stuff. And you work all day, every day. The last thing you need is to come home and see all these tweets from people being really nasty to you. What's it like in the industry? Is there like a concerted movement towards shutting these people down, or are there support groups, or is it just kind of like, just ignore them because it's not worth the time, and actually focus on the positives of the work that you're doing instead?
My experience is more the latter, like you said, just kind of ignore the stuff, because I think a lot of the people that get most of the hate are people that are quite vocal online and sort of have a platform to be vocal. And then it's like you said, it doesn't encourage science communication. And that's the point. The people who are harassing in these movements, they're going after that chilling effect. They want to intimidate, they want to fear monger, and they want to scare people, and they want to essentially silence voices. And again, I get it, because no one deserves to experience that. And so if people don't want to engage in science communication for that reason, I totally get it, and that's fair. At the same time, there's some people who, myself included, where it ends up just strengthening our resolve. So I like I said, I've been sort of well practiced at managing it over the years, and I've sort of I found out ways to drown out the noise. And at the end of the day, my eye is on the prize, so to speak, which is to help people protect themselves from the misinformation and propaganda, no matter the harassment I'm receiving.
Yeah, absolutely. And well done for that. I think it's really important to have allies in this movement. We're talking about healing and recovery and trauma, and whether or not it's Scientology, if it's any sort of cult or abusive relationship or whatever, there are similarities in that healing process, and communities exist online to help people. And that's what I'm trying to focus on, is that support side of things. And we need people like you to help guide us in the right direction. How do we find real information about mental health, and how do we avoid those obstacles of pseudoscience and stuff? So I'm looking forward to reading your book that covers that, and kind of gives a little blueprint for how to find that, I suppose.
Yes, thank you.
There's some really good questions here, actually. And this is one I was going to bring up anyway from Educon. Does Dr. Stea think the profession can do more to address the needs of cult survivors?
That's a really great question. I think there's always room to do more. Yeah, I mean, I think to me, it's a personally fascinating area of research. And I think there are, there's, in academia, you will find subgroups of, say, researchers or career scientists who are devoting their lives to better elucidating how to help people in that area. So I think that's an ongoing thing. And I hope those researchers and academics are able to get funding to better understand and to fund the research so that they can do that stuff. Clinically, I mean, I don't know that I've had necessarily, on my 9 to 5 is seeing people with concurrent addiction and mental health concerns. I've had a few who have been in cults, but I wouldn't say it's the most common thing. And so, I think I'm saying that is with respect to that could be a barrier of funding, right? So the academics and the scientists really need to make a case, which obviously it's super important. But when it comes to making decisions at levels of funding, it's the top guys who make the decisions about which research to fund. I think obviously we need to do more.
Yeah, I think education is really, really important, and it's striking that balance, isn't it? Because as someone who left Scientology and started seeing a counselor who was, they weren't a clinical psychologist, but they were accredited and all of this by the BACP here in the UK. And he was really good, but he didn't have a clue about how Scientology operates. He understood that it was a coercive group and it was a cult, but I spent a lot of time that I was paying for explaining to him how Scientology works, and then he used his expertise to try and figure out what that meant in terms of its impact on me, and then how best to support me. And it made the world of difference when I changed to seeing a different therapist who was trained in the psychology of, you know, these coercive groups and cults, and understood Scientology, so I could explain, oh, you know, they told me to do this or this happened, and use the Scientology term, and they understood what I meant and how it affects the brain. And that made such a big difference to my recovery journey. How do you think, like, it's hard because I'm not, and we aren't mental health professionals, so we can't educate you on how it works, but we can educate you on what it is, I suppose. How would you advise would be a good kind of approach to doing that, that ultimately leads us to a place where we have more people who are trained in Scientology and cults that have a professional background in psychology? Does that make sense? Very
Makes
long-winded
sense.
way of asking the question.
No, it makes sense. It's a tough question, and so at the end of the day, it comes. I don't know, like at the systemic level, how to do it. It would be great if, you know, that could be part of continuing education programs, say, for various disciplines like social work or psychologists or psychiatry, where people could, say, sign up for workshops or continuing learning opportunities where they bring experts in on the psychology of cults and the psychology of helping survivors. And that can be sort of a way for frontline mental health professionals to learn how to do it. So that's one way to do it, sort of at a systemic level. The other level is at the level of the individual clinician, which unfortunately you're going to find a lot of variability. As you said, you can get good counselors, you can have unhelpful counselors. And so at that end, it's really the onus is on the ethical duty of the clinician to do their due diligence, to try to help their patients as best as they can, which means trying to go out of the way to discover the research literature on it and the clinical guidelines on it, and to basically inform themselves how to best help people.
Sure, absolutely. Okay, thank you. And then Storm Pugglesworth, great screen name. This kind of relates to what we were just talking about. Question: how do you research and get good sources to use in your work? I'm missing my degree course a bit post-university.
You're researching at good sources to use in your work. That's a good question. So this is part of my beef, so to speak, with unregulated health professions, because they don't know how to do that. And so in psychology, at least in clinical psychology, we adopt what's called a scientist practitioner model, which means in order to get our training and in order to get licensed at the Ph.D. level as a clinical psychologist, we need to be able to know how to evaluate the scientific literature, and then how to bridge that gap between the research and clinical practice. So we're literally trained how to do that. We're trained how to find credible sources of information, read the scientific literature, understand randomized controlled trials, and just try to understand how to incorporate that in clinical practice. It's a hard thing to do. All of us can improve, but that's literally that's the philosophy behind evidence-based practice in clinical psychology. If you and I'm to some extent that will extend to other that should extend to other bona fide health professions as well. It sort of captures the spirit of evidence-based medicine. So social workers will have that in their codes of ethics as well. Same with psychiatrists and other physicians. The downside is the reality is that there's a lot of variability between practitioners, and so people, quite frankly, just vary in their skill with knowing how to do that. And it's a skill that needs to be continually honed and practiced.
Sure. Okay, fantastic. Thank you. Road to Freedom here is asking Dr. Stea, do you think genetics play a role in psychiatry? And how far is science, including that in current research into mental health?
Yes, genetics play a huge role in psychiatry. But again, it's limited to with respect to how far we've come. And so when I mentioned earlier the biopsychosocial model, what that means is trying to have researchers and clinicians understand the biological contributions to mental illness and mental health, the psychological and the social. And that will vary between various conditions like schizophrenia and bipolar disorder, which tend to have a higher genetic loading than others. But it's always what we call the etiology or the causes of mental illness are, again, to be transparent and in the spirit of science, it's not well elucidated and it's not well known. We have people in the lab right now devoting their career, and for decades before us and decades from now, literally devoting their time every day trying to figure out the causes and the nature of mental illness. And they're looking at it through genetic lenses, psychological lenses, social lenses, and the interaction between those variables. It's very, very, very complex. And that in and of itself is an important message, because in pseudoscience, all of that complexity is stripped away. For example, Dianetics knows everything. The wellness industry knows everything. And those are the lies that we really want to be able to help people understand.
Yeah, I think that's absolutely right. And I think that it's really important to educate yourself as much as you can and read from as many different sources as you can. And you don't have to be really into the field of mental health and psychology to read a few articles and get a basic understanding of how to navigate this, right? Sorry, go on, were you going to say something?
Yeah, no, that's exactly right. And to maybe go to credible organizations to get some of that information and fact sheets. So in Canada and the USA, there's the American Psychological Association or American Psychiatric Association. There's the Canadian Psychological Association. So I'm sure the UK has similar associations where you can get some of that info.
Yeah, absolutely. And Nika Case Turing here says psychiatry had a dark past. Even my mum still thinks that they do bad stuff. How would you advise going about approaching a conversation with something like say, for example, to a family have left Scientology and the younger person has got some information about how mental health support actually may be helpful, and maybe everything they've been told about psychiatry and psychology might not be completely accurate, but the parent is still a staunch, not Scientologist, but believer that psychiatry is bad. Have you got any advice on how to approach a conversation with somebody like that to kind of open their eyes to another way of thinking?
I would say to validate that and to, again, approach conversations with transparency, honesty, and humility. So acknowledging, yes, psychiatry does have a dark past. Absolutely. Its past is morbid, like we mentioned before, inhumane asylum care, inappropriate pathologizing in minority groups, etc. Treatments that were harmful. That's why the anti-psychiatry movement developed in the 60s. And so it was a reaction to psychiatry's missteps. And so to approach that conversation, I would say, to acknowledge that stuff, and that what makes psychiatry a science and not a pseudoscience, as opposed to Scientology, say, is that psychiatry embodies the scientific spirit, which, as you said, is open to changing its mind with new evidence. It's open to acknowledging its dark past. It's open to trying to make everything better for patients, making safer treatments, making more effective treatments, and being open to new evidence. It's very open-minded in that way, as long as it follows the scientific method. That's the nature and the spirit of a science, as opposed to a pseudoscience or a fake science, which is to do quite the opposite, which is to think in very black and white ways, simplistic ways, and to fuel a divisive, polarizing narrative against mainstream medicine for their own interests. It's not for the interests of patients and patient care. It's for their own interests, their own financial and ideological interests.
Yeah. Absolutely. Scarlett Phalanges here says, so pseudo Scientology, in fact. I love that. I think that's a really good term.
That's fantastic.
I love that. So let's start, as we start to wrap up here, because I know you've got a hard cut in a few minutes. I just want to remind everybody the importance of education and what is to come in your book. Remind me of the release date of your book here, Mind the Science. When's it coming out? Next week, you said?
September 3rd, so a couple weeks. Yeah,
Okay.
so September 3rd in Canada and the US. It can already be pre-ordered across the world, including the UK. It's just that the UK hardcover may be delayed a bit, but I still think the audio version will be available and the ebook. But all of the various formats can be pre-ordered now. So thank you for helping me to get the message out.
Yeah, for sure. And thank you for coming on. I think there's so much on my list of stuff that I wanted to talk to you about that we didn't even touch on. I think a final thing while we've got a little bit of time is, I don't know if you're aware of this, but in Canada, a Scientologist in Quebec has just been charged with 6 counts of practicing medicine without a license. Essentially, what happened is a French-speaking Canadian documentary went undercover into the Church of Scientology, posing as somebody with bipolar disorder and asking for some sort of help and support. And the Scientology church staff members told them that they need to do a course of vitamins and then do the purification rundown, which is what's delivered at the Narconon centers as well, that you mentioned earlier. Was sent to this mechanic who also happened to be a Scientologist, who then told this person that bipolar is a made-up disease. This course of vitamins will help them. They need to come off their medication that was prescribed by a doctor, take these vitamins instead, and that's what will help you. And then the Royal College of Physicians, or whatever it's called, the regulator in Canada, looked into it, did their own investigation, and found that this person was still doing this in Canada. And now there's going to be a big court case about it. What's your reaction immediately to this whole concept of Scientology practicing medicine without a license?
I'm appalled. I think that's the stuff that makes my blood boil, and it's precisely the reason why I wrote my book in the first place. And it's interesting that, we didn't really get into it, but that Narconon program that you're saying, like, it's Scientology, but it's also wellness. That's why I wrote the book, because they're saying you can megadose vitamin D or vitamins. You need to have a drug-free withdrawal program when they address addiction, which is incredibly medically unsafe, especially from things like an opioid addiction or an alcohol addiction. It needs to be medically monitored. You can't have a drug-free withdrawal program. People can have really severe withdrawal symptoms. It can even be fatal. And so even, you said that detox, some sort of new life detox program where they need to, get rid of the harmful toxins from their body. Toxins also is a wellness buzzword. It's a wellness term, which doesn't really have medical value. And again, so it's almost like Scientology. That's what I mean by them being bedfellows, the anti-psychiatry movement in the wellness industry, because in that case, Scientology is using wellness kind of tropes and wellness alternative medicine ideas to grift and to eventually hurt people. That's a very dangerous thing. And that's exactly why I wrote my book, because I want people to be able to see that if it's ever happening to them or a loved one, so that they can protect themselves from it.
Yeah. And especially with the purification rundown, maybe we'll do a second video talking about this, because I think this is a whole other topic. But there are children in Scientology buildings across the world at the moment doing this program, which involves taking thousands of milligrams of niacin and other vitamins, sitting in a sauna for 5 hours a day, and running and doing this program with the idea of sweating out your toxins, which, I'm not a scientist, I'm not a professional, but that seems pretty dangerous to me for a child to be doing that program. And the more people we can get to expose it and talk about it, the better.
Yeah. Good God. That's horrible. And then not to mention, there's the direct harms of therapies themselves like that. Then there's also the indirect harm. So if someone actually is experiencing a mental disorder or severe distress, like a post-traumatic stress disorder or depression or anxiety, the last thing they need is to be sweating it out in a, God knows whatever it is that's pitched to them. They need evidence-based care. That's what they deserve.
Yeah, absolutely. Dr. Jonathan Stea, thank you so much for this. I've really enjoyed this conversation. Is there anything else you want to add before we wrap up?
No, that's great. I had a lot of fun, Alex. Again, I admire you. I admire the community you're building and the work that you're doing. And so I'm grateful that you had me on. So thank you.
Thank you. Thank you very much. And guys watching this on the replay crew that didn't catch this live, leave your comments and questions down below underneath the video in the comments. And, you know, we can go through them maybe in a second video, or I can email them to Jonathan and hopefully get some responses and keep the conversation going. And don't forget to order Jonathan's book. The link is in the description down below. And we'll see you guys on the next one. Thank you so much.
Thank you.